into the femur.
So why don't we see the last video? Go ahead and roll.
These are just actually still photographs of an actual implant. Again, this is a procedure done on a human being. These are the implants as they fit on there. This just shows how they fit on the patient's bones through a very small incision.
How long does this operation take?
The operation, it varies. It takes roughly an hour to do the actual operation. The OR time obviously varies. The patient's got to be taken into the operating room, as you know. You've got to induce anesthetic. Anesthesia could be either a general anesthetic when you're asleep, it could be a spinal when you're numb from the waist down, or a combination of the two.
There we're seeing the drilling, or?
Oh, these are the pins. These are just the pins placed to hold the cutting guides in position.
And so after an hour and a half procedure, the patient wakes up, and how long are they in the hospital?
Well, typically, the patient, after an hour, hour and a half procedure, you go to the wound's got to be closed. You take into the recovery room for an hour to 2 hours, depending on your medical condition. And then you're brought downstairs to the hospital, to the main floor. And you'll be in the hospital for about anywhere from 2 to 3 days, typically. And in that time, what goes on? The first day, I try to get my patients out of bed that day and get them actually standing at the bedside. One thing I tell people with arthritis, they're not sick. They have a bad knee. Arthritis, although it's a disease, it's not like a pulmonary disease or heart disease. These patients, a lot of times, are very healthy or they're medically very stable. They just have a bad knee. And that's an important point to bring up to the patients. Once the knee is replaced, the cartilage, the bad cartilage is gone. You can start putting weight on this knee immediately. That's why I try to get my patients out of bed that day, put full weight on the knee that day, get the knee moving that day. We don't want to waste any time. The longer you stay in bed, flat on your back, your increased risk of getting bed sores, getting pulmonary problems, getting blood clots. These are all risks that can occur with surgeries with this new modern procedure as well. So since there's less blood loss and less pain, people can get out of bed quicker. And that's the real upside of this operation. People get up quicker, they'll leave the hospital quicker, and they have less chance of getting these complications that occur in hospital. Now, while some people feel that the MRI beforehand may be an added expense, what I think we're going to find out as we go forward is that any added expense of the MRI is going to be more than offset by the decrease in hospitalization costs, the decrease in cost in pain medication, the decrease in the use of blood products post-operatively, the quicker recovery, quicker return to work, more predictable return to activity. So you're going to have a happier patient that's more productive. That's going to get there quicker.
So the overall cost should decrease.
I think there's no question that the overall cost will decrease, especially as MRI becomes much more efficient and much more available. Again, if you look at 2020 or 2040 is not that far away, and the number of people needing knee replacements is just going to go exponentially higher. We've got to find a better way in this day and age to make this operation more efficient and more cost effective, and I think this is a major advance in that direction.
So by putting in these customized implants as opposed to taking something off the shelf and trying to fit it to the patient, you get better alignment, you get a more preservation of the soft tissues, and that should allow these things to last longer.
Yes. You've got to look at this knee as when the knee goes in a person, is in there for several years, and suppose you get up every day and you walk your dog. You get up every day and you walk to get the newspaper. If you multiply this, as I said, by weeks and weeks and months and years, there are millions and millions of cycles going on through this knee. And this is a machine. It's a piece of metal and plastic in your body. Anything that's mechanical will wear out. And if you could try to minimize the risk of it wearing out, that's going to have tremendous upside. And with this thing, if the bone cuts aren't made just perfectly, if you don't get the axis between the hip and the knee and the ankle just perfect, that's going to lead to a poor outcome and a shorter lifespan of this implant. Right now, about 90% of these last 10 to 15 years, and that number should improve as we get further along. Not only that, they're expanding the application. Younger, more active people are getting knee replacements.
So we just have a couple of minutes left. I wanted to ask you to just summarize some take-home key points for patients.
Okay. Well, again, this implant is a specialized implant, requires some specialized training. It's done in very few hospitals here. I primarily work at El Camino Los Gatos. We're doing that here, a very aggressive program of joint replacement at the new hospital. I'm very excited about that. This implant, I think, is really going to be the way to go in the future, for the reasons I said. More predictable outcome, less blood loss, less perioperative complications, a happier patient, a more functional patient. It's just a smarter way to do knee replacement. You're trying to make the implant fit the patient. The tail isn't wagging the dog here. You don't want to make the patient fit this implant. You want some more physiologic, more logical way to go.
Well, that's a very, very exciting. I know that knee replacement has been a relatively morbid procedure in the past, and it sounds like this new advancement will allow more patients to have knee replacement more safely. And now that we're fitting the joint to the patient, it also should last longer and help people play golf longer.
If you must, yeah. Yeah. If you must waste your time playing golf.
Well, thank you very much. We appreciate your time.
It's good to see you again.
It was a pleasure to have Dr. Terry Delaney from Los Gatos, California, orthopedic surgeon specializing in joint replacement, and he was very kind enough to share this new technique of MRI-assisted customization of knee prosthesis, which is the new most modern approach to knee replacement.
Thank you.
Thank you very much.